We have 3,500 people all working together at this trust to provide the best quality care for our patients. Did you know we carry out 115,000 x-rays every year? Our therapy teams see more than 125,000 patients. Our pharmacy team dispenses 20,000 items per month alongside 1,000 prescriptions with a yearly drug expenditure of £13 million. And blood sciences carry out more than 1.5 million investigations annually. All of these activities take place within the Clinical Specialist Services Division, an incredibly hard-working and dedicated team that works alongside medical and nursing teams.
Okay. 1, 2, 3.
To outline the division's involvement, we will use the example of a patient who has suffered a stroke, a condition that requires input from all areas of the Clinical Specialist Services Division to contribute to their effective management. Typically, a patient suffering a stroke will be rushed to our emergency department by ambulance. Our emergency department team will be informed in advance, and paramedics will fast-track this patient to a treatment room where a dedicated team will be waiting to assess. Here you can see our stroke matron waiting with the other emergency department staff. An initial assessment will establish whether or not a stroke is the cause of the patient's symptoms. Time is critical. Within an hour of arrival at the emergency department, the patient will be taken to our imaging department to establish the type of stroke. This determines if thrombolysis is appropriate for the patient. Here, the patient has been taken for a CT scan. Our imaging department is a large part of the Clinical Specialist Services Division and also includes radiology, ultrasound, MRI and mammography. Their influence and activity covers a wide range of treatment and diagnoses from cancer and stroke to pregnancy and the routine chest X-ray requested by your GP. If the scan determines the stroke is an infarct, the patient may be a candidate for thrombolysis, a clot buster medication that, where appropriate, must be administered within 3 hours of first experiencing the stroke symptoms. Whatever kind of stroke is diagnosed, the patient will be transferred to our dedicated stroke unit, Eastwood Ward, where the patient will be nursed by the ward team. On reaching the stroke unit, other groups of clinical specialist services staff will begin their involvement in ensuring a clinically effective patient journey. We have a dedicated team of phlebotomists who take bloods for analysis. This can be for a number of reasons. For example, to diagnose any other condition that may require treatment, to identify certain types of treatment, and monitor their improvement. The bloods will be sent to our pathology labs for a number of predetermined tests. Our pathology service consists of biochemistry, cytology, haematology, microbiology and histology, as well as having responsibility for the Trust's transfusion services. The results will be sent back down to the ward, where they will be reviewed by the patient's consultant. On admission to the ward, the pharmacist will review the patient's medications to ensure safe and effective prescribing. A ward-based electronic prescribing system means all medication can be dispensed appropriately. The ward-based pharmacist advises and supports the medical and nursing staff to optimise the medicines needed to help the patient's recovery. The consultant will continue to assess the patient and address any medical issues. In the management of stroke, early involvement by the therapy teams is important to promote recovery of function. All therapies are involved in assessing the patient needs within the first 48 hours of admission. Stroke rehabilitation covers all aspects of function: nutrition, communication, movement, self-care, medicines optimisation. In line with the national standards from the Royal College of Physicians, the Clinical Specialist Services Therapy team assess the patient and set goals with them for their recovery. Around 2/3 of stroke patients experience difficulty with swallowing, and speech and language therapists assess and treat these swallowing difficulties. Another third will have problems with language and struggle to express thoughts or ideas through speech. Other motor difficulties can make speech slurred or unclear. Speech and language therapists will assess, treat and support the patient and carer in the path to recovery, working closely with other members of the stroke team.
Alright, and I'll see you again tomorrow.
Okay, well, thank you.
Thank you.
Goodbye.
Bye.
Thank you.
Yeah, so that, if you don't get that knee supported.
Mobility and motor functions are commonly affected by stroke. Our physiotherapy teams work from day one to rehabilitate movement and maximise functional recovery. They advise the rest of the team on best therapeutic handling to aid recovery. Our purpose-built rehabilitation centre has a wealth of physio equipment, including movable stairs, balance aids and walking equipment. The patient is encouraged to do all of the hard work, with the physiotherapists a constant source of support to help the patient get as mobile and independent as possible. In Suite 5, the physios can access the hydrotherapy pool and neuro gym to support their work on Speedwell. The stroke unit also has a separate social activities group on Speedwell, designed to bring a bit of normality away from the clinical environment of the ward and to assist adjustment through shared activities and peer support. The group also has use of a purpose-built garden with basketball net, flower garden and more. A number of patients have found their outlook on therapies changed for the positive from working in a group setting with people who have shared the same experience. Good nutrition and hydration are paramount to good recovery. Dietitians support the stroke team in advising and managing appropriate clinical nutrition for those patients who need to be fed artificially as a result of their stroke. They also help meet the needs of the individual patients, supporting dietary management of diabetes and food allergies, amongst others. They provide healthy eating advice and support the stroke team in trying to meet the energy and fluid requirements of all patients to help aid good outcomes. Being able to walk, talk and eat is one thing, but functional recovery includes all those day-to-day tasks we may take for granted. Getting in and out of bed, getting washed, getting dressed, making yourself a hot drink, preparing a meal. These can become extremely challenging following a stroke due to either physical or cognitive impairment, and often both. Occupational therapists ensure that the patient can function as independently as possible and provide support and practical aids to assist with this. They help the patient to gain the confidence they need to feel mentally and practically prepared for discharge. Discharge home can be a daunting experience when you've become used to having such a large number of healthcare professionals around you in the safety of the ward. A new development for the Trust is early supported discharge. This is a new initiative supported by commissioners where those patients who are suitable can be discharged home with input from the nursing and therapy teams to support them in their recovery and continue their rehabilitation in their own homes. This additional support will greatly increase patient confidence and functional recovery, allowing them to live their life in their usual environment. Early supported discharge will be a valuable extension of the work already established in the inpatient setting to continue the patient's journey to recovery.